Welcome to the Living Kidney Donor Education Session. This education session has been designed as a self-guided PowerPoint that you can view at a time that suits your schedule. The education session must be completed during phase 1 of the evaluations, as it provides important information regarding the entire evaluation process. It also provides resources and donor testimonials that you will find helpful as you begin your journey of becoming a living kidney donor. Please take notes if needed, and we encourage you to view the presentation more than once. After reviewing the PowerPoint, you will be required to submit an electronic form indicating that you have done so. You can indicate on the form if you have additional questions and would like a follow-up phone call from the living kidney donor nurse. To begin, our team would like to thank you for your interest in becoming a living kidney donor. Whether you are coming forward to donate to a family member, friend, neighbor, acquaintance, or you have decided to donate anonymously, our team acknowledges that living kidney donation is a very generous, selfless, and thoughtful act, and we are here to support you throughout the process. As a living kidney donor, you are required to sign 2 consent forms prior to starting the evaluation process. Both consent forms are provided to you when you receive the welcome package from our program administrator and are reviewed by your living kidney donor nurse. It is important to know that a living kidney donor may withdraw from the evaluation process at any time, even if they have already signed the consents. You do not need to provide a specific reason for wanting to stop the evaluations, and we fully support your decision. There are 2 different healthcare teams that take care of the donor and the recipient. As a living kidney donor, your care will be provided by the living kidney donor team throughout the evaluation process. This team is separate from the recipient team. We will not provide any information to a recipient or recipient family member or friend that calls our program asking about a living kidney donor's workup or evaluations. We fully recognize that in many cases, donors and recipients have some form of a relationship, and you may share information with the recipient directly as you wish. There are many advantages to living kidney donation. Finding a living donor at an early stage of kidney disease may allow the recipient to avoid dialysis completely. Receiving a kidney transplant before starting dialysis is referred to as preemptive transplant. If your intended recipient has already started dialysis, receiving a kidney from a living donor may reduce the length of time spent on dialysis. Without a living kidney donor, the current wait time for a deceased donor kidney in Ontario, depending on blood type, ranges from 2 to 5 years, and in some cases up to 7 years. We also know that recipients who receive a kidney from a live donor generally have longer organ survival rates. This is partly due to more time and planning available for tissue typing between the donor and the recipient, and a better tissue match means higher compatibility and less risk of organ rejection. On average, a kidney from a living donor lasts 15 to 20 years compared to 10 to 15 years from a deceased kidney donor. There are some important points to consider about the evaluation process. Everyone has their own personal work, family, and social commitments and will progress through the evaluation process at their own pace. On average, a complete evaluation takes approximately 4 to 6 months. However, this may be shorter or longer depending on factors such as donor availability, geographical location of the donor, or the recipient's readiness for transplant. We want our donors to know that our program cannot pressure you to complete testing and will only proceed with those donors who actively participate in their evaluations. In Canada, it is illegal to solicit an individual for organ donation, and therefore we will not put undue pressure or stress on a donor to complete evaluations. If at any time throughout the evaluation a donor would like to pause their testing, they may do so and resume when it is more suitable to their schedule. As mentioned previously, donors may withdraw from the workup at any time. Let's meet your living kidney donor team. We have one program administrator who you will have contact with via telephone or email on a regular basis. The administrator will communicate information about tests and appointments that need to be completed and provide you with an agenda when you are required to visit the hospital. We have 3 registered nurses with the program, which your donor file will be assigned to. They will support and guide you throughout all phases of the evaluation process. There are 3 kidney specialists, also known as nephrologists, that support the nurses in providing your care. Donors will meet the nephrologist in person at the end of Phase 2. Donors will have an assessment with our program social worker, and in some cases, a donor may be required to meet with a psychiatrist. There are 3 kidney transplant surgeons, known as urologists, at the Ottawa Hospital who perform the donor surgery. Lastly, both community and Ottawa Hospital labs play an important role during your evaluations. You can reach the Living Kidney Donor Office at 613-738-8400, extension 82719, or livingkidneydonor@toh.ca. livingkidneydonor@toh.ca. During the evaluations, our team must consider the following: the current health of the potential living donor, risk factors to the living donor should they proceed with donation, and the long-term health of the living donor after donation. Please note that the living kidney donor team will focus on your health and safety. This remains our primary objective throughout all phases of the workup. There are 5 phases of the living kidney donor evaluation process. Each phase will now be discussed in more detail. You are currently in Phase 1. By now, you have completed the medical, social, and travel questionnaire and have signed both consent forms. You will have also had communication with your living donor nurse by a phone call or an email. Other tasks that need to be completed during Phase 1 are review of the self-directed education session, which you are currently participating in, blood and urine tests on 2 separate occasions, and an in-person nursing assessment at the Riverside campus. If you are over the age of 50 or have a family history of certain cancers, we will reach out to your family doctor to assist us in ensuring your cancer screening is up to date. This includes screening for breast, prostate, colon, and cervical cancers. A very important step in Phase 1 is the cross-match test, which determines your compatibility with your recipient. This testing will be arranged by your nurse and coordinated with the Ottawa Hospital Tissue Typing Lab. I will now take the time to discuss in further detail the role of the Tissue Typing Lab at the Ottawa Hospital. Tissue typing looks at how genetically similar or dissimilar you are to your recipient. Blood samples from both the donor and the recipient are compared or mixed together, otherwise known as a cross-match test, to ensure that the recipient blood does not react to your blood. A reaction would indicate that the donor kidney could be rejected if it were to be transplanted into the recipient. This occurs when a recipient has certain antibodies that recognize and attack foreign blood or tissue. A recipient's antibodies can change over time, and therefore we must perform another cross-match test a few weeks before the transplant to ensure the recipient has not developed any new antibodies. We are often asked by our donors if it is better to be biologically related to the recipient. While this can be beneficial, it is not required. Whether you are related or unrelated to the recipient, anti-rejection medications have improved over the years, making a non-biologically related donation a good option for the recipient. The cross-match test must be done at the Ottawa Hospital. A pre-booked appointment will be arranged by your nurse for you to come to an Ottawa Hospital lab to provide a blood sample. This test is a simple blood test for the donor, but the information it provides is extremely important in determining compatibility with your recipient. A negative cross-match result indicates compatibility with the recipient, and a positive cross-match result indicates incompatibility with the recipient. The results of the cross-match can take up to 2 weeks, and you will be informed of the results by your nurse. Cross-match testing is different than having the same blood type as your recipient. It is important to understand that a donor who has the same blood type as the recipient may not necessarily be a compatible match. It is the cross-match test that determines compatibility with the recipient. If the cross-match results are positive, you are considered an incompatible match to your recipient. Although you will not be able to directly donate your kidney to your intended recipient, there is the option to donate through the Kidney Paired Donation Program, also known as KPD. KPD is a national program run by Canadian Blood Services. both the kidney donor and the recipient are entered into the KPD program as an incompatible pair. A recipient may have multiple donors who can be entered into KPD with them, essentially increasing their chances of receiving a kidney. Please note that living donors participating in KPD still need to complete all phases of the evaluation process and be deemed a suitable donor. Living kidney donation through the KPD program is anonymous and you will not know who receives your kidney. You are donating your kidney to someone that you do not know in order for your recipient to receive a kidney transplant. Likewise, your recipient will not know who their donor is. If KPD is an option for you and your recipient, your nurse will discuss the details with you. If you have come forward as an anonymous kidney donor, you may also participate in the KPD program. The following 2 slides will provide a graphic of how kidney paired donation works. A potential donor and their recipient are called an incompatible pair. Even though they are not a match with each other, the incompatible pair can consider taking part in a donor exchange or swap by entering the KPD program. Once matched, a detailed graphic is shared with the transplant centers that are included in the chain. The graphic shown on this slide depicts a 3-pair chain. Donor A will donate to recipient B, donor B will donate to recipient C, and donor C will donate to recipient A. Chains can have as few as 2 pairs or even up to 6 pairs. Transplant centers throughout Canada can participate in KPD. If you live outside of Canada, you will not be able to participate in the KPD program. For those living donors who have come forward to donate their kidney anonymously, the domino exchange or domino chain is executed. In this graphic, the domino exchange begins with an anonymous donor who donates to the recipient of the first registered pair. There can be multiple registered pairs in a domino exchange. The exchange is complete when the donor of the last registered pair donates to a recipient who is on the deceased donor waitlist. Not only has the anonymous donor been able to start a chain whereby several recipients receive a transplant, but they have inadvertently removed a recipient from the deceased donor waitlist, resulting in that recipient receiving a kidney from a living donor. Recipients who are on the deceased donor waitlist do not have potential living donors, and therefore this type of domino chain significantly impacts recipients with living donors and those without living donors. As mentioned previously, if KPD is an option for you and your recipient, or you are an anonymous donor, your living kidney donor nurse will talk with you in more detail about this process. You can also visit Canadian Blood Services webpage at www.blood.ca to learn more about living kidney pair donation. When all of Phase 1 testing has been completed and the results have been reviewed by our kidney doctor, your nurse will call you to let you know if you can proceed to the next step, known as Phase 2, or if additional testing is required before proceeding to Phase 2. If test results in Phase 1 indicate that you are not a candidate for living kidney donation, your nurse will have this discussion with you. It is important to remember that if you are declined as a living kidney donor at this time, it does not necessarily mean that you have ill health. Although you have come forward to donate your kidney to someone whose health is compromised, please know that your health before, during, and after kidney donation is being considered and is of the utmost importance to our team. We want our donors to live a long and healthy life after kidney donation, and if there are any signs in Phase 1 evaluations that suggest otherwise, you will be declined as a living donor. If you are declined at this time, you will not be moving forward to Phase 2 testing. If you have been cleared through Phase 1, you are now set to begin Phase 2 testing. The tests and appointments listed on this slide are requirements of Phase 2. However, similarly to Phase 1, results of the testing may indicate the need for further investigations or referrals to specialists. Phase 2 testing takes approximately 6 to 8 weeks to complete, and we will try our best to book some of the tests and appointments on the same day. Most of these tests and appointments will require you to come to Ottawa. Let's discuss the tests in Phase 2 in more detail. The renal scan tells us how well each of your kidneys are functioning. After an IV is inserted into your arm, a technician will inject a radioactive tracer into the IV, allowing pictures to be taken of the blood flowing through your kidneys. Generally, each kidney contributes approximately 50% to your overall kidney function, and this is desirable for you to safely donate a kidney. The amount of radiation that is used during this procedure is about the same amount that is used during an X-ray. The renal scan is done in the nuclear medicine department. Another very important test is the CT scan. This allows the doctors to look closely at the anatomy of your kidneys, such as how many arteries and veins each kidney has. The CT scan also helps to determine which kidney would be the best to remove for donation purposes. The CT scan takes approximately 30 minutes. Next is an ECG or electrocardiogram. This is a non-invasive test that records the electrical activity of your heart by placing 12 stickers on your chest and attaching them to a machine to record your heart rhythm. This is a simple and quick test. Lastly, a chest X-ray is done to take a picture of your lungs. This is a simple test that uses a small amount of radiation. All potential living donors will meet with the program social worker in Phase 2. The social worker will discuss your work, school, financial, and family background, as well as your motivation to come forward as a living donor. Sometimes an individual comes forward as a living donor because they feel they have to do it for their friend or family member, or perhaps they have been pressured by family or friends, or even the recipient to come forward as a donor. If you have experienced this as a living donor, your appointment with a social worker is an ideal time for you to voice your concerns, as it is a safe, confidential, and non-judgmental environment. Should you choose to withdraw from evaluations at this time, our program will fully support you and your decision. Not all living donors need to be assessed by our program psychiatrist, but all anonymous donors are required to be seen by the psychiatrist. The social worker's assessment will also play a role in determining if a referral to a psychiatrist is needed. Your appointment with the transplant surgeon will take place after your CT and renal scans are completed. The surgeon will review both reports and images in detail to determine if they can safely remove your kidney and which kidney would be best to remove. Surgical technique and risks of kidney donation and surgery will be discussed with you at this appointment. All three of our transplant surgeons perform laparoscopic kidney removal. This will be discussed in further detail later in the presentation. Sometimes a surgeon will conclude that there is a risk to the donor if they perform the surgery. This could be based on anatomy of the kidney or the location of the kidney in the abdomen. There are times that an individual is declined as a donor based on these types of technical issues. During your consultation with the transplant surgeon, risks of the surgery will be discussed with you. These can include death, bleeding, blood clots, infection, pain, damage to other organs, reaction to anesthetic, and testicular swelling or tenderness. Please feel free to ask the surgeon any questions you may have about the surgery. They will be happy to answer them at this appointment. The last appointment of Phase 2 is with the kidney doctor, also known as the nephrologist. The nephrologist will thoroughly review all of the testing completed in Phase 1 and 2. During your appointment with the nephrologist, a detailed health history and physical exam will be obtained. The nephrologist will explain the benefits and risks of donating your kidney and make a final decision if you can safely donate your kidney. Please note at this point in the evaluation process, you may still be declined as a living kidney donor. The team's decision to decline an individual is taken very seriously, once again keeping in mind that the current and long-term health of our donors is our #1 priority. There may be some unexpected discoveries that may delay the evaluation process. You may be told that you have high blood pressure or diabetes, that you have an infectious disease, or have a health issue that you did not know about before testing was started. If this is the case, our team will refer you to the proper specialist or contact your family doctor to let them know they will need to refer you to a specialist. You may also be told that you need additional medical testing, such as a cardiac workup, genetic testing, a 24-hour blood pressure monitor, or a kidney biopsy before you can proceed any further with the evaluations. Furthermore, you may be informed that you are not a suitable donor due to an emotional or mental health issue. This does not permanently discount you from donating your kidney. However, it could delay the process and contribute to the final decision regarding your eligibility. Another example of an unexpected outcome of the evaluation is discovering that you are not biologically related to your intended recipient. This does not include non-biological pairs such as friends or coworkers. Other items you may want to consider as you get closer to the end of the evaluation process is your ability to take time off of work and the impact living donation may have on your family, work, social, or travel commitments. The living donor team will discuss these specifics on a case-by-case basis and do our best to support you in reaching your end goal of being a living kidney donor. Those considering kidney donation should think about getting life insurance before donating. Fortunately, most insurance companies do not charge more for insurance. However, it is possible that during the evaluations, a medical condition might be identified that could affect life insurance coverage. For anyone undergoing major surgery, it is encouraged that they consider making a will and designating a power of attorney before the operation. The Ontario Ministry of Health established Preload to help reduce some of the financial impact of living donation. Preload is administered by the Trillium Gift of Life Network to reimburse living donors for certain qualified out-of-pocket expenses related to travel, parking, meals, and accommodation during the evaluation phases and at the time of surgery. It does not reimburse all expenses, but it aims to reduce some of the financial burden that might prevent someone from becoming a living donor. Our program social worker can also help you with the application and answer questions regarding the Preload program. You can visit the website listed at the bottom of the slide to find out more about Preload. Medical safety issues are the predominant reason why we decline living kidney donors. Diabetes or signs of prediabetes, uncontrolled blood pressure, obesity, inadequate kidney function, unexpected abnormal kidney anatomy, and any other serious ongoing health issue are some examples that would determine a donor's inability to donate. There are many factors to consider as you move through the evaluation process. As you finish phase 2, the living donor team needs to determine if you are healthy enough now to donate your kidney, if your kidney is healthy enough to give to your recipient, and will you remain healthy for your lifetime after donation. If you are not able to donate your kidney or you need more testing completed before proceeding to phase 3, our team will ensure that you receive the support and guidance you need at this time. We are here to help you. At this time, we would like to share with you information regarding the Phase 2 one-day evaluation. We are proud to be one of the few programs in Canada to have implemented this model of care. During a one-day evaluation, all Phase 2 testing and consults with the living kidney donor team are conducted at the Ottawa Hospital General Campus between the hours of 7:30 a.m. to 4 p.m. This occurs once a month and can accommodate 3 potential donors. There are several factors to consider when booking a potential donor into a one-day assessment, and your nursing coordinator will discuss if this is an option for you. If you are medically cleared and found to be a suitable living kidney donor, you will receive a phone call from your nurse telling you this exciting news. You are welcome to share this news with your recipient. At this time, we will also inform the recipient team that the donor has been cleared for donation. We want to be clear that the final decision to donate your kidney is entirely up to you. Donors are free to change their mind at any point in the evaluation and even after they have been cleared to donate. If you decide not to donate, the team will fully support you and the reasons for your decisions will remain confidential. Phase 3 begins once a donor has been medically cleared to proceed with donation. If the recipient is ready for transplant, a surgery date will be discussed between the donor and recipient teams, with consideration of both donor and recipient availability. If both the donor and recipient have been cleared for transplant and are willing to proceed at this time, we generally book the surgery 4 to 6 weeks in advance. Please be assured that if you have travel plans or family and work commitments, or simply want to donate at a specific time of year, we will plan a surgery date that suits your schedule and that of the recipient. You will never be forced to donate at a time that is not convenient for you. Once a surgery date has been finalized, you will require specific testing and consults to be completed within 30 days of the surgery. Your nurse will provide you with a written agenda outlining these details. This includes an appointment with the transplant surgeon who is scheduled to perform your donor nephrectomy surgery and an appointment with the anesthesia team who will put you to sleep for the surgery and monitor your pain medications after surgery. Preoperative blood work will be completed 10 days prior, and this will include a final cross-match test between you and the recipient to confirm compatibility. 2 weeks before the surgery, your nurse will call you to complete a questionnaire. 2 days prior to your surgery, you will meet with your living donor nurse to complete some final paperwork, a short pre-op questionnaire, and have a COVID-19 nose swab. At this appointment, your nurse will provide you with a package that includes your post-donation follow-up appointments for the coming year and accompanying lab requisitions. As mentioned, a detailed agenda will be provided outlining all Phase 3 test and appointment dates and times. Phase 4 consists of the surgery itself and recovery the day of the surgery. All living kidney donor surgeries take place at the Ottawa Hospital General Campus on Thursday mornings. You will be asked to arrive at approximately 6 a.m. on the morning of your surgery to begin preoperative routines before the scheduled start time. In most cases, the donor surgery begins at 8 a.m. and takes approximately 3 to 4 hours. Laparoscopic donor nephrectomy is the most used surgical technique. The transplant surgeon will explain this in detail during your consultation a few weeks before your surgery. In brief, this technique uses a few small incisions in the abdomen. A tiny camera is inserted through one of the incisions, and the surgery is performed watching a monitor. The surgeon inserts special instruments through the incisions to detach the kidney, which will then be removed through a lower abdominal incision that is approximately 3 to 4 inches in length. Once the kidney is removed, it is flushed with a special solution to help preserve it prior to being transplanted into the recipient. Once the kidney has been removed and the surgery is complete, you will be transferred to the recovery area and monitored for approximately 1 hour. After this, you will then be transferred to the inpatient surgical unit located on the 7th floor of the hospital. Pain management options will have been discussed with you prior to your surgery. This could include a pain pump whereby you push a button to deliver pain medication as needed, or taking pain medication by mouth. If you are experiencing symptoms such as nausea, bloating, or constipation, please ask your bedside nurse for medication that can help alleviate these symptoms. The day after your donor nephrectomy surgery, Phase 5, or the recovery phase, begins. This includes recovery in the hospital, discharge from the hospital, and the weeks following your surgery. It is important to remember that each person experiences the recovery process differently, but we will share with you the most common aspects of the recovery to anticipate. The day of your surgery, you can expect to have a tube in your urethra to help you pass urine or pee. You may have short 1-inch oxygen prongs in your nose to ensure you are keeping your oxygen levels up. You will have an IV in your hand or lower arm to provide fluids to you. This will be removed once you start drinking and are tolerating liquids. Compression stockings will have been applied prior to going in for your surgery. These compression stockings help move blood around and prevent clots. Once you are up and moving, these stockings will be removed. Lastly, you will have a bandage or dressing over your lower abdominal incision site. You will be provided instructions as to when this dressing or bandage can be removed. The day after your surgery, you can anticipate that you will be sitting up at the side of your bed, sitting up in a chair, and most likely walking. We encourage you to ask for assistance from the nursing staff if you are unsure of how to get out of bed and mobilize the first time you try to do it on your own. They will be happy to help and share tips with you on how to ambulate while at the same time providing some support to the incision site. The days following your surgery, you will have the following removed: the urinary tube that helps you pee, the oxygen tube in your nose, the IV in your hand or lower arm, and the compression stockings. As patients begin to drink more and move about, these devices will be removed. It is also important to remember that if you have continued symptoms such as bloating, nausea, constipation, or pain, that you ask your nurse for medication that will help alleviate these symptoms. It is not uncommon for some of these symptoms to persist the first week or so after surgery. Living kidney donors generally go home 2 to 4 days after their surgery. You may still be experiencing some pain or tenderness at your incision site or nausea or bloating at the time of discharge from the hospital, and this may last several days or up to a few weeks after surgery. Pain medications will be tailored to your individual needs, and we do encourage you to continue your pain medications as prescribed. This will allow you to move more freely, which in turn can be beneficial for other symptoms such as bloating. Within 1 to 2 weeks after surgery, most donors have reported to us that they have minimal pain at the surgical site. You may still require over-the-counter pain medication, such as plain or extra-strength Tylenol, and please keep up with this if it helps. We would like to remind you at this time that living kidney donors should only use Tylenol or acetaminophen-based products. Please avoid any anti-inflammatories such as Motrin, Aleve, Advil, or ibuprofen. If you are unsure whether a medication is an anti-inflammatory, please reach out to us or speak to your local pharmacist. You will resume regular activities such as walking, bathing, and taking a regular diet, but please do not lift anything over 10 pounds and avoid any sudden twisting or bending. For 6 weeks after your surgery, or as indicated to you by your surgeon, please avoid lifting anything heavier than 10 pounds and avoid activities such as shoveling, raking, golfing, or vacuuming. You will gradually increase your activity level, but please listen to your body as you are recovering. You may find that you get tired more easily as your body is using its energy to heal itself. Often past donors have reported to us that their energy levels are the last to return to their pre-donation level. Your return to work will depend on the type of work and required activity level while at your job. Most donors take a minimum of 3 to 4 weeks off work, while others will take upwards of 8 weeks off work. Most donors have returned to work 8 weeks after their donor surgery and have resumed regular daily activities. If your employer requires a letter of support, please reach out to our program. We would like to acknowledge that some donors may need to process the emotional aspects of being a living kidney donor. Up until your surgery, much of the focus has been on you, the donor. Once the transplant takes place, the focus often shifts to the recipient while the donor recovers from their surgery. Donors may feel down, sad, or depressed after donation and grieve the loss of their kidney. During the donor's recovery, they may be more isolated from family and friends or their normal activities. Please allow yourself to take the time to recover both physically and emotionally. If you would like to have social work support during the recovery phase, we encourage you to contact your living donor nurse. Follow-up care after kidney donation includes an appointment with the surgeon 4 to 6 weeks after the surgery and an appointment with a kidney specialist at 6 months and 1 year after your surgery. Each appointment will require you to have blood work drawn approximately 1 to 2 weeks prior. An agenda with appointment dates and blood work requisitions will be provided to you by your nurse before your surgery. At the 1-year follow-up appointment, you will have the option to transfer your care to your family doctor should you choose. If you do not have a family doctor or prefer to be followed annually by the living kidney donor team, this will be arranged. We strongly recommend that you maintain your annual follow-up appointments, whether it be through your family doctor or the living kidney donor program. We anticipate your life after kidney donation will be quite normal and you will remain in good health. There are some healthy strategies that we encourage you to consider. Regular exercise 3 to 4 days a week is encouraged, but please avoid contact sports that may damage your remaining kidney. Please avoid the use of anti-inflammatory drugs such as Aleve, Celebrex, Advil, Motrin, or ibuprofen, as these types of drugs are associated with kidney damage. If you are unsure whether a medication is an anti-inflammatory, Please contact the Living Kidney Donor Program or speak to your local pharmacist. We encourage you to drink 1.5 to 2 liters of water each day and maintain a healthy diet by following Canada's Food Guide. Female donors should wait a minimum of 6 months after their donation before becoming pregnant. The Living Kidney Donor team strongly encourages you to maintain a relationship with your family doctor, nurse practitioner, or physician assistant both before and after living kidney donation. You will require their services for medical concerns unrelated to your kidney donation, such as prescription renewals, vaccinations, cancer screening, referrals to specialists, and treatment for acute illnesses. Our program uniquely provides annual post-kidney donation care in the form of blood pressure checks and review of kidney function and urine testing for protein. But it is beyond our scope of practice to provide additional services that would otherwise be provided by a family doctor. COVID testing is required for all living donors. You will be required to have a COVID-19 nose swab 48 hours prior to your surgery. The recipient will also be required to have a COVID-19 test the day before their scheduled surgery. We encourage you to have your COVID-19 vaccines up to date and recommend that you take extra precautions such as masking, practicing social distancing, and limiting your social interactions 2 weeks prior to your surgery. Please be aware that living donor surgeries have been delayed due to the donor or recipient testing positive for COVID-19 within 48 hours of the scheduled surgery date. The Transplant Ambassador Program is a group of volunteers that have either donated or received a kidney and welcome the opportunity to share their personal experiences with you. You can even request to speak with a living kidney donor who is of similar age to you. Transplant ambassadors are real people to whom potential donors can reach out to directly. This may be helpful as real-life experiences of a donor may inform you in different ways than the Living Kidney Donor Program. It is entirely patient-centered and patient-led by dedicated volunteers. You can reach out to the program directly, or we would be happy to put in a referral for you. Please take a moment to watch this TAP video. At this time, we are excited to share with you living kidney donor testimonials from past donors. Each of these kidney donors came through our program at the Ottawa Hospital for their assessments and surgery and continue to be followed on an annual basis for their post-donation kidney care. We are very grateful that they have decided to share with you their own unique experiences and continue to dedicate their time to the Ottawa Hospital Living Kidney Donor Program. Please take a moment to listen, watch, and enjoy their stories on the next slide. To learn more about living kidney donation in Ontario and Canada, please visit the websites provided on the slide. The following 2 slides consist of frequently asked questions by our donors as they begin to contemplate becoming a living kidney donor. Please take the time to read through each slide as it may answer some questions you already have. We also encourage you to reach out to your living donor nurse if you have any additional questions throughout the evaluation process. We will be more than happy to answer as many questions as you have. Patient feedback is crucial to improving care for all individuals at the Ottawa Hospital. The Living Kidney Donor Program is no exception, and your feedback is important to us to help improve the evaluation and donation processes. When providing feedback pertaining to your experience as a living kidney donor, you may want to consider the following. How did our program do at helping you through each phase of the process? Were you clear on what testing and appointments you were required to do? How was the communication with your living donor team? What did we do well? Was there anything you didn't quite understand? And is there something specific we can improve on? Any feedback is welcome, and we will strive to incorporate your suggestions into our daily practices. There are several ways in which you can provide your feedback to the Living Kidney Donor Program. All donors will be provided a patient satisfaction survey and prepaid addressed envelope, which can be mailed to us at any time. You may also contact your living donor nurse, transplant clinical manager, or transplant clinical care lead directly at the numbers listed on the slide. Alternatively, you may contact the Ottawa Hospital Patient Relations Office at the number provided. On behalf of the entire kidney transplant team at the Ottawa Hospital, we sincerely thank you for your interest in living kidney donation. We would like to recognize your time commitment and dedication to the evaluation process. For those individuals that proceed to donating a kidney to their loved one, friend, or anonymous recipient, your generous and selfless gift is making a tremendous difference in the quality of life for an individual in need of a kidney transplant. This concludes the Living Kidney Donor education session. Please remember to complete the electronic forms questionnaire that was emailed to you with this PowerPoint presentation. Receipt of the electronic form will confirm your participation in the donor education session. Thank you.